Hey guys, welcome back. We are going to go over some scripts today, all right? In particular, we're going to go over the LIS script, standing for low income subsidy. I'm just going to kind of share and go over what an outbound call would look like with us, okay? And so this script is to help somebody see if they qualify to get back the $170.10 in 2022 for the Part B premium, all right? I'm going to call Miss Mary, just making up that name. And let's say, for example, she's a preset appointment. I will then kind of identify it as well and show you guys how you maneuver through the script. It was really hard, as I mentioned before, like there's 4 scripts that I took to make this kind of like one script that I think has a good flow. Don't be surprised if it's a little weird to you in the beginning, like, okay, where do I go next, etc. A lot of companies have like 40 pages of scripts. So I was trying to make it as concise as possible. Okay. So feel free to print out the script, which is what I recommend if you're like a paper kind of person and need things in front of you, just so that you can familiarize yourself. I personally like it on the computer screen. That's why I always recommend and almost require that you guys have 2 screens, because then you can have the script open on one screen, your quoting tool, etc., on the other screen, and operate from that perspective. All right. I'm just gonna get started. Hello, Miss Mary, how you doing today? All right, you always want to smile when you dial because it does make a difference. You can hear the difference in tone. My name, and then I'm right here. My name is Kevin Miller. I'm calling regarding the appointment that you set with my assistant, Miss Susie. I am a licensed advisor in the state of Georgia, right? With your senior benefit solutions, speaking on a recorded line. Now, I'll be happy to assist you with any questions that you may have today. And Ms. Mary, my call is in regards to your request to see if you qualify to save the $170.10 on your Social Security check for your Part B premium. Remember that. Kind of jogging her memory here. Oh, yeah, remember. Now, guys, if most will say yes, but for the ones that do say no, just jog their memory by saying, remember, Social Security deducts the $170.10 for your Part B premium for the Medicare insurance, right, on your monthly check. Now, let me just go ahead and verify your address. Whatever you have, if that's an address, zip code, or whatever it is that you have, right? Just verify something. The point here is don't get stuck there. You're making a statement. You're really not asking them. You're telling them, right? Because you're in control of this discussion. And then you move right on, okay? Miss Mary, for your protection, I do need to inform you that this call will be monitored and recorded and may be shared with the insurance companies who administer the plans we offer. All right. I also want to let you know that you will not be required to provide any health-related information unless it is necessary to determine your enrollment eligibility. Now, do I have your permission to record and continue this call? Yes, you do. All right, great. Now, to determine your eligibility, I will ask you just a couple of questions. Okay? Yes. I want them to nod. I want them to agree with me because by the time we get to the sale, I want them to do the same thing and we can move on, right? Great. Miss Mary, the program is income and asset based, meaning they look at how much income you receive each month and how much you have and if you have any assets. All right. Now we do understand that you're on a fixed income, and if we can make that stretch a little bit more, that would really make a difference. Wouldn't you agree? Oh yeah, with everything going up, da 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 da. Right? We want them to understand that we know what they're going through. We know what it is like because our aunt is on a fixed income or whoever, we know people, right? So that way they kind of feel familiar with this. They can kind of seem like, oh, he must be working with a lot of seniors because he already knows that, right? That there's more month than money left. I use those kind of phrases a lot because that's what I hear. I catch on for my clients and I write them down. And I'm like, I'm gonna tweak that into my script because that is familiar. And what's familiar resonates, right? Now, are you on Medicare or Medicare and Medicaid? Okay. Now, Ms. Mary, are you on Medicare or do you have Medicare and Medicaid? Right? If the answer yes for Medicare and Medicaid, you want to continue all the way in the below section to the yellow highlighted point. Okay. I am going to scroll back up, but I do just want to mention If they do not qualify for LIS because they make too much or they're already on Medicaid, you don't just want to say, oh, you don't qualify, right? You're losing an opportunity here. Just because they're already on the Medicare plan does not mean that they're on the best plan. They might not have ever been properly educated. You never know, right? They might have been stuck on the same plan for 5 years because they never really wanted to make a change. And today is the day that they feel like, maybe I will see what this TV commercials out there have to say, right? Because they hear it on the radios, TV, they get phone calls all day long. All right. You would just simply say, great, let me go ahead and get you pulled up in the system. Be so kind and grab your red, white, and blue card, your current insurance carrier card, and your Medicaid ID card since they are on Medicaid. Okay. And then you would continue the script. I am going to go scroll back up, guys, because Miss Mary is not going to have it. So I can go through the full script with you all. Okay. So if they do not have, if they do have Medicaid, you scroll all the way down. If they do not have Medicaid, you continue with question number 2. All right. Well, I'm only on Medicare. Okay, gotcha. And how much do you draw each month on your Social Security check or any other income that you have? I draw $978. Okay. Now, Miss Mary, the $978, and I'm still here, is that what comes into your Social Security check, or is that actually is the $170.10? Is that what basically you get in total on your Social Security before they take out the $170? Well, I don't know. I get I get $978. Okay. You always have to add the 170.10 unless somebody's already on Medicaid, they don't pay it. But otherwise, most people don't know that they automatically withdraw before they actually issue the check. Okay. Now, do you live by yourself or with a significant other? Because if they have a spouse, guys, okay, if they do have a spouse, we want to make sure they get the spouse's information as well, because we need to actually get the information from both, okay, and not just the one, because then we're looking at both individuals, as you guys can see here. So the table for you as an individual, she said she makes 978 plus the 170, so she falls between those two categories. But if she has a spouse, the spouse can only, if the spouse and her draw about $900, they won't qualify for this program here, right? Maybe they might get LIS, right? Which would be great. There's plans for LIS. So you would do the math real quick on your calculator. That's why I always have my calculator open on the other window, and then type it in quickly to see, would this make sense to fill out an application, because we don't want to waste our time. Okay. And then you move on to the next one. All right. As I mentioned, and then so we are at number 4. And by the way, who do you currently have for your health insurance, like Humana, United Healthcare, or Aetna? Oh, I'm with Humana. Take a mental note, or actually write it down on my calendar, because I'll bring that back up later, right, on the appointment on Google Calendar. All right. Now, if the client does, or the potential client does not have LIS or Medicaid and qualifies from an income or asset perspective, right, want to just continue below. All right. Now, permission to contact would be next, and we must read. Now, in the event that our call is getting disconnected, do I have your permission to call you back at the phone number that you just called for the appointment, 803-334-2646? Yes. Great. All right, Ms. Mary, what I'd like to do now, I would like you to go ahead and grab a piece of pen and paper. I have some important information that I'd like for you to write down, okay? Let me know when you're ready. And then you just wait for them. While they're grabbing the piece of pen and paper, guys, you can open your Sunfire if you don't have it open. You could utilize most of the times we have the zip code. You can plug in the zip code into Sunfire already. You can prepare. She said she has Humana. You could even see, all right, what Humana plans are in her area. Let me familiarize myself to as long as I can with the information, to then see by the time she comes back, I might already know what's out there. Sometimes there's 3 Humana plans and sometimes there's 20, right? So clearly then it's going to be harder. But if you're in an area where there's 3, and as soon as she tells you, you can almost finish that sentence for her and say, oh, I'm really familiar with it. You pay $5 a month when you go to see your primary doctor, right? Okay, great. Let's see if we can get you qualified, Ms. Mary, because we might be able to If you do get approved, get that down to zero because your specialist is $45, correct? And I know that can kind of eat into your budget every month if you have to go 2 or 3 times a month to see a specialist, right? Oh yeah, it's hard. I haven't even been to see my specialist because I just can't afford that. You will get those kind of responses. Okay. All right. So I want you to write down my name. Okay. My name is Kevin Meller. So my name is spelled KevinMehler. Okay. And you want to slow that down based on how fast they are. All right. And then also I want you to give I also want you to write down my phone number because I'm going to be your personal one-on-one advisor moving forward. And my number is 803 blah 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 blah. All right. Now I also want you to write down my national producer number. Okay. This way you know I'm nationally registered to assist you today. Let me know when you're ready. All right, I'm ready. 187 blah 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 blah. Okay. And you can have simply your NPN if you don't know by heart. You can have a little sticker on your screen, or you can have it popped up on your computer, right? You might have like a little notepad on the wall or anything, a note section, depending on how you operate. All right, now, Ms. Mary, based on the information that you provided me, you may be eligible for 2 programs. The first one is called LIS. This program will lower your prescription drug costs to $3.80 for generic and $8.95 for brand-specific medication. The second program is called Medicaid. This program has about 5 different levels, and regardless of the level, you would receive back the $170.10 that Medicare takes out of your Social Security check. If you are approved, you would see an increase in the amount of $170.10 on your monthly check. All right. Now, in order for me to assist you with answering those application questions, please go ahead and grab that red, white, and blue card, your insurance card for me. All right. And while you do that, Ms. Mary, what is your date of birth? They oftentimes have to leave to go grab it, even though in a preset appointment we share with them, please have that ready for us, right? But it's all good. So while they go grab that information, if you are able to speak with them, I want their date of birth because I can start writing that stuff down, right? And even if I needed to look up if they have LIS, etc., I could at least now put in their first name, last name, date of birth. That's already 3 things checked off the list, right? Okay. So once they come back, we are here, guys. Okay, great. Now, since we're applying for this program on the government side, I will ask, it'll ask me to put in your social. What is your number? Okay. Here, guys, you don't want to change your tonality. You want to just keep talking the way you've been talking. If you start talking like you're scared to ask for a social or anything of that nature, we'll make it very clear that we are helping them apply online because most seniors don't know how to fill out an application or they don't have access to a computer device. So in this case, we're assisting here, okay? If they prefer to fill it out themselves, we can always send them the link. We do not get compensated for this. However, it does help us once they fill out the application. If we're very certain that they qualify for LIS, we could enroll them already in a plan that has LIS. And up to Medicaid, which we know we never enroll into Medicaid right away. We always wait for Medicaid's approval because each application does require for us to put in the Medicaid ID number. Otherwise, Medicaid, the dual special needs plan cannot get approved without validating that somebody has Medicaid. Okay. There is a few carriers now, and Humana just started it as of April the 1st, 2022, where you're able to, let's say your client is getting eligible for Medicaid. They already got the letter in the mail that they just got approved, and starting the following month, which would be May the 1st, then you could fax in that letter into the carrier letting them know. With United Healthcare, for example, they give you 21 days or 20 days to verify or validate that you have active Medicaid by sending them a document as well showing proof of it, and then they'll wait. But Humana, for example, let's say you put it in on the 25th and the plan is supposed to go in effect May the 1st, you have to ensure that you actually fill in that you provide them the documentation within a few days. Otherwise, that application will be canceled out. Okay. All right. And then also your insurance company ID card. What is your plan ID number? Okay. We do have that instructions, guys, right? Because members don't know where they find it. They will give you the member ID number. There's nothing we can do with that. We need the plan ID number. Each plan has a plan ID number associated with it. And I created like a little cheat sheet that will show you what that plan ID number could be. Okay. So this is, for instance, in Georgia, the Medicaid ID card. So with Humana, for example, guys, here in the bottom right corner, you see the CMS number. Okay, it says CMS, and then we'll have the plan ID number. Okay, with WellCare, for example, it's up here, WellCare, and then it has the RX, and then if it's an HMO or PPO, and then here's again the plan ID number. Most plans that I've personally looked at and worked with or dealt with, they have either an H or an R or something in front, a letter, and then they have 4 numbers, 3 numbers, dash 3 numbers. Okay, so this is kind of a very common number. If a lot of clients either give you this plan number, 80440, which a lot of plans have that same number, or they will give you this member ID number. So it's really important that you as the advisor know where on the card per carrier is their actual plan number located. Okay, here again we have CMS in the bottom right corner with Aetna. With Cigna, we have it down here. United Healthcare is on the opposite side from Humana. It'll be down here. Okay, sometimes we have it up here. So in this case, it is actually up here. So forgive me, I said down here, but it's actually up here. And then we have Anthem, right? Let's see, we have Clover, which we don't use too often, but so you have to be it's really important that you do have, with Clover, it's right here, for example, that you do have that information. Okay, and it is accessible on our classroom as well as on the Google Drive, so you will have access to it, and I have that link embedded here so that you can utilize it. Okay, now Ms. May, are you currently receiving social SSI? Okay. Now, and then also, what is your marital status? Okay. These are questions that are actually, guys, on the LIS/Medicaid application. So we're asking that now because we will need the answers to those. Okay. So if somebody asks you, why are you asking me? Let them know. All right. As I mentioned, you are able to ask those questions because here's the link. And this is with the client's permission, you will complete that, okay? This is just a double check based on the specifics of this application if they still qualify, okay? There's no need for us to spend 20 minutes if we know that they have $26,000 in the bank, which disqualifies them, all right? What your mails does on the lowest day of the month and after you pay all your bills, how much money do you have in the bank? The reason I stated the question this way, guys, is they basically asking a question on the application is on an average monthly basis, how much money do you have in your bank account? They're nosy, right? And you can say, Ms. Jones or Ms. Mayer, I'm not nosy. I'm just simply asking you the questions that they ask you. I know they're nosy. Ha, 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 ha. Do you have any investments such as a 401k, stocks, bonds, or any real estate that makes you some extra money, right? A rental property. All right. Oh, I wish. Yeah, that's what most of my seniors say because you have more month than money left, right? And then do you have any life insurance? And how that if they do have it, how long have they had it? If it's whole life, do they have any cash value? It is not something that counts against them. Okay, so you can tell them, Ms. Mary, this is not something that counts against you. They're just simply asking for it. Okay, and then we want to make sure that they don't have too much in assets in their cash value. You would know if they had a whole life policy for 20, 30 years, there might be a good amount in there if they haven't borrowed from it. A lot of people do borrow from their policies, okay? And this would be an opportunity at a later time also to come back and cross-sell here, okay? Now they also look at how much money you have in the bank. You don't have $1 million in the bank account, right, Ms. Mir? Okay, you kind of joke with them a little bit, but really the goal here, Ms. Mir, is they want to make sure that you do not have more than $24,999 in your bank account. That is kind of the max that you can have in the bank to qualify, okay? Now, again, if somebody answers yes or basically has investments, etc., that will very likely disqualify them from the program. Okay. If everything looks good, you would just simply come here and start filling out the application with them, right? That will open up the application. All right. And we have the questions that are on the application right above here, and it'll automatically send to the Medicaid office, their local Medicaid office, the application if you do not check the box. So you just leave it unchecked. Okay. Now, Ms. Mary, the next steps, in 2 weeks, you will receive a letter in the mail from the Medicaid office with a letter stating if you got approved or denied for the first program called LIS, meaning if you are eligible, this program will lower your medication costs, right? For the generics and the brand specific names. And then also this letter will have a one-page document included that you need to fill out and complete your Medicaid application. Once completed, just put it in the envelope and send it back. Okay, the envelope is provided. You just put it in, send it back in the mail, and that goes to your local office. From that day, you can expect another letter within about 4 to 6 weeks from the DFACS office. Okay, that's usually the time frame. As soon as you get the answer, please give me a call, and you will, because then you will be eligible for even more benefits if you do get approved. Okay, so if they now got approved for Medicaid, guys, you want to be the one to find out first, because if another agent finds out, they upgrade them, and then you might have lost the opportunity. Hence why we have a document, an Excel spreadsheet, and you can use what you like, where I enter everyone that I fill out or assist filling out LIS or Medicaid. I enter them on that document, and at least once a week I go through that, check by using either Jarvis, using Humana's side, or even calling into the carriers to verify Medicaid eligibility, right? Because eventually, if they do get approved, you would see their Medicaid ID number on there that will tell you, oh, they now got approved. Okay, and I did a video on how to check for that, so you could utilize that. All right. Now we're at the point where it says if they already have Medicaid, continue here. All right. Let me get you pulled up. Please provide, etc. So you would just the only thing you would leave out here is those two, and then you would start back here. Okay. All right. To make sure we find the right plan that works for you with what you're currently doing, what doctors do you currently see? All right. Take a note of your name. Some people only know the last name. Some people know the first name. Some people know the phone number. Some people know everything. It kind of depends on how organized they are. Really good, important point here, guys. If somebody doesn't know the doctor's name, they maybe just started with that doctor. It's very common that if they have any prescribed medication, that the doctor's name is on the pill bottle. So you can simply say, go ahead and grab your pill bottles for me. Your doctor's name is probably on there. Otherwise, be ready to Google here, right? If they tell you they see Dr. Griffin and he's their cardiologist, and if they're in their same zip code, or is he also here in Gwinnett County or wherever you are, wherever that person is located? Oh no, they're in Smyrna. Wonderful. Then I will Google Dr. Griffin, cardiologist, Smyrna, Georgia. There's probably not that many coming up. You could even then start rattling down that street address to them. Oh, is he on Mason Street? Right? Oh yeah, that sounds about right. Great. So now you know the doctor, and do that for every doctor. You do need their doctors because for one, you have to make sure they're a network, but also for two, we want to make sure that we verify that all the doctors are in network. So it's really one main reason. Okay. All right. And then the next thing is, once you got all the doctors, are there any medications that you'd like me to research and confirm that they will be covered? Okay. We do want to get all medications, guys, because that's another reason. If the client is currently paying a certain amount, we want to make sure that we either beat the price, if not offer the same. Even though they will not pay more than the $3.95 or the $8 or the $9 and some cents, right? We do want to make sure, because each medication is based on a formulary, and every company has their own formulary guidelines. So meaning one plan with Humana could be $0 for the meds, but then there could be another plan where the meds could actually be $200. So you want to be very specific and careful, because those are all reasons. If you tell them one thing and then they get another thing, Those are reasons why they would cancel. They're not happy. I mean, sure, we wouldn't be happy, right? If somebody tells us A, but we get B. And then also, I just want to add here real quick. I know I mentioned your medication will cost this amount and that amount. There's multiple levels of LIS that people get. Same thing with multiple levels of Medicaid. So those do play a big factor in what level of medication cost you will then experience, okay? So just because somebody has Medicaid doesn't mean they automatically just pay $3.95. With generic medication, it's very likely, but the brand-specific medications, those can be more expensive depending on your tier level, okay? All right. Now that we have that taken care of, let me see if you qualify for an upgrade on your Medicare plan, okay? So initially, we're done with that process as far as Medicaid and LIS, right? But now we're still on the phone. We have all the information, right? We have the medications. We have the Medicare plan. We know what plan they're on because we asked them to give us the plan ID number. So we can now do some shopping around. Oh, I'm happy with the plan that I'm on. Miss Mary, that is great. And I commend you on that, okay? I'm just making sure I'm going over the basics with you. I'm just doing my job here. So let's just review what you currently have, right? And then you could focus on, for instance, dental to see is their co-insurance, right? Their monthly premium, their co-payment when they do see a primary or a specialist to kind of see how much are they currently paying. Can I find them something that's more beneficial? Okay. My recommendation here, if you did apply for LIS and Medicaid, is seeing is there an LIS? I call those LIS plans. Basically, a plan available that has a monthly premium plan payment, but for people that have LIS or Medicaid, that would be that plan would go to $0, right? Most of the time, if you have level 1 through level 6 with most carriers of LIS, that would then give you a $0 plan. And you can simply check that by going into Jarvis. I'm sorry, you can go into Jarvis to see the level of LIS, but you can go into Sunfire to then actually play with the numbers and say, okay, this plan costs $32.60. Now, let me see if I say, yes, they have LIS, what it will lower it to. And that system will then show you if it's $0, $9 or whatnot, okay? But there is a lot of plans that actually go down to $0. And the benefit of it is not just that it goes down to $0, but those plans are more beneficial, okay? So meaning they have greater benefits, such as most of those have a $0 copay for the primary. And then I've seen a lot of those plans where the specialist is only $15, where the dental benefits are greater than on any regular and Medicare Advantage plan, okay? It's kind of like the next level, or in my opinion, the plan between a regular Medicare Advantage plan and a dual special needs plan or a chronic special needs plan. They're here, the regular Medicare Advantage plan, and then I feel like the LIS plans are in the middle from a benefits perspective, okay? I hope that makes sense. All right. So then we're looking if they have, all right? We do look at the medications. Now, for your notes or for your steps of action, if you're still unsure, right, if they have LIS or what level, you can always confirm that by going to Jarvis or United Healthcare enrollment. If you don't know if they have Medicaid, LIS, you always want to check on United Healthcare, right? You can see, let me just double check. I'm unsure because she did say she doesn't pay the 170/10 or they don't take it out of her check, but she's also just on a regular Medicare Advantage plan. You will find people that they're already on Medicaid, they just don't know it, okay? Which means you're eligible for an upgrade. You can use if it's available, that SEP, depending on the time of the month that you're in, you can use the special enrollment period that the dual maintaining, right? They have Medicare and Medicaid, they haven't used their dual special needs plan eligibility period, and so you would use that as an enrollment code, okay? Next step for you would be to open Sunfire if you haven't already and create a Sunfire profile for them, right? So that you can actually begin the comparison. Hopefully you have already done that while she was grabbing her cards. Like I said earlier, have your Sunfire system open, the script on one, then the Sunfire system is set on the other, so that you can start creating a profile while you see you're going this route, okay? And then you want to open the census tab, put in the client zip code. You want to select the medications tab to add the medications. it's really, really vital that you already have all this open, because when they give you the medications, don't type that in your notes, type them in there. And when you're done, you're able to just copy them and then boom, drop them in your notes section in case you ever out at the grocery store and she calls you and say, hey, did I ever tell you I also take lisinopril? Yeah, let me just check here. And you have it, okay? And just be careful to save that in a very secure spot because it is HIPAA compliant. So really, you have to be very careful storing individuals' information because we can get in trouble for that. Okay. And then next thing, step number 5, you'll input the info, find out if their current plan and if they have any concerns. Here, it's really important that you would listen well, right? Now, Ms. Mayor, are there any concerns that you have, or like, are you planning on getting any dental work done? Are you planning on getting new eyeglasses? Because I'm wearing my glasses right now, and if I don't have them, Ms. Mayor, I can't even see. So I need my extra set of eyes, right? Kind of have that kind of discussion because this will really show you the little loopholes or the little pockets that you can fill, because those are concerns that they're bringing up, right? And if you can find a solution to their concerns, you're the hero and you're able to achieve an enrollment, okay? So let's say she says, yeah, I actually need some dentures, I need some tooth pull, and you already have their plan information. You can simply say, so if I hear what you're currently saying, Ms. Mary, right? You want to find a plan that actually, you repeat exactly what they told you, get you better benefits in the dental department, right? And then also the any other benefits that you're entitled to, right? Yes, that's right. Okay. After listening is actually report, right? And also it creates tie downs, okay? Now, if a member has LIS or Medicaid, enter that information in the bottom of the census tab. So that's the last step. So here it's really showing you what all you need to fill out: zip code, medications, and then LIS or no LIS. Those are really the main 3 things, right? There will be other things, but if you look at the video recording that I did on Sunfire, you'll see we don't fill out everything because a lot of things do not either 100% work like the doctors look up to. Unfortunately, it's not 100% accurate, so I wouldn't rely on it. So therefore, no need to put it in. You can, totally up to you, but you're just doing extra work. And then also there's some questions like what's important, vision, dental, etc. If you put it in, that's great because you have it in the profile. I rather write that in my notes section, simply because if you plug it in the system and then you go away, you for one no longer see it in front of you, whereas my notes section will stay open while I'm operating in Sunfire. But more importantly, Sunfire doesn't change or give you different plan options because you put in that they need vision benefits. Okay, at least from what I've seen, it is a newer. They've added this tool, but I haven't seen anything shift when I click they need dental, that now all the dental plans will be at the top or the most benefit rich ones will be at the top. Okay. So therefore, in my opinion, as of right now, it's not fully functional maybe, or I'm not sure, but that's why I say don't waste your time. All right. And then the next is on Sunfire under the miscellaneous tab. All right. Select the prospect's current plan based on their plan ID number, and then you want to add up to 2 additional plans. This step number 7 is kind of optional. I would definitely recommend it if you're not familiar with the plans out in an area, that you do add it. It's really important because it gives you opportunity to see it side by side. Okay. And I have kind of laid that out in the Sunfire video. So just jump back to that if you're unsure what I'm referring to. But the downfall, so to say, if you do not know the plans, which is totally fine, you then only have 2 options to compare. Whereas if you know the plan, you have 3 options. But I definitely say if you're new or you're unfamiliar with Sunfire or with plans in general, start off with this. Eventually you'll get the hang of the plans because they only change once a year, right? So eventually you get the hang of it unless you work in a lot of different areas. All right. So you want to do that and add those additional. The goal is to compare plans that are more benefit rich, right? Focus on the 6 main areas, which would be the monthly premium. So if there is a premium, will always be at the top for the plan, right? Second would be the annual dental coverage allowance. So what I mean here is how much do they have in an allowance to spend? I'm not asking can they get 2 cleanings a year or 3 cleanings a year? A lot of these plans nowadays come with $1,000, $2,000, $750, and dual plans up to like $5,000 in spending on dentures, crowns, etc., right? Because that's what a lot of people need services done. I need tooth pull, I need crown, I need dentures, I need a bridge, you name it, all right? So you want to make sure that you focus on that area, tell them how much they get in that particular area, which I'll show you in just a second. And then the next thing is 3, which is the primary care physician copay, as well as the specialist copay. Okay. Now, Ms. Jones, your primary is $0, your specialist is $25, for instance, but I can get you $0 and $50 on this plan. Okay. Then number 4, the monthly, quarterly. Some plans have a monthly, some have a quarterly over-the-counter allowance. So how much do they have? Over-the-counter allowance, guys, basically, they will get, with most carriers, a booklet. Okay, it's an over-the-counter booklet. You can think of it like a little a brochure with a whole bunch of things such as vitamins and toiletries, a stool to sit in the shower, for example, things of that nature, like helpful things for seniors, right? And they get a monthly or quarterly allowance, what they can order at no cost to them based on the allowance out of that booklet. Okay. Some carriers will allow you to come into the CVS, for instance, WellCare, right? They allow you to come into the grocery store. There's most CVSs, they participate. There's some that don't. So I always recommend them to call before they go and then take the booklet with them. That store or facility is supposed to have a booklet, but some do not. So I would always recommend bring the book so you know exactly what you can order, because you can't get shampoo, but you might be able to get toothpaste, right? So you really have to make sure that you look at the items in the book, because you can't just buy anything. Okay, it's not just a debit card that you can use for anything. All right. And then the next thing is your annual vision benefits allowed, as well as your inpatient hospital stay amount. Okay, so the annual vision benefits is the same thing. How much do I get for glasses and contact lenses a year, right? And then the inpatient hospital stay amount is in the first few days of you staying in the hospital, usually on average, like day 1 through day 5, there's a daily amount. If you just have Medicare and not full Medicaid, is the only way you don't have to pay it. With full Medicaid, just to be clear here, you do have a monthly, a daily amount that you have to pay out of pocket, right? Which falls into that 20% that Medicare doesn't pay. Okay. We always want to shine the most light on whatever they brought up to your attention. So if they tell you already that they do not wear glasses, right, then there's no need for me to try to be so excited that the client would get $400 in eyeglasses, because if I'm not going to use the benefit, why are you so excited about it, right? So try to focus on the areas. I'm not saying don't bring it up. I'm just letting you know, if somebody tells you, oh, I really need some dental work done, then get hype about it if you're able to find them a plan that gives them great dental coverage, because that's easily an opportunity for them to say, oh yeah, please switch me over because I can't afford that anyway. Had plenty of clients that did it because of those reasons, right? If they see there's a huge benefit for them, like us, then we will make a switch, right? All right. All right, and then let's see, discuss and compare the benefits of all 3 plans based on the 6 overall main subheadings using the plan comparison guide listed below. You then want to kind of see where is the client at, right? And then use eHealth or the carrier site to verify the doctors and network before we come to a final conclusion with suggestions. And then with the client's permission, do move forward, complete always the scope of appointment, right? If you haven't by now, which we should always do in the beginning, or either the text and email signature for scope of appointment. Otherwise, we can always use the carrier voice signature option, which is available with most carriers. Okay. Now, how do you transition into the presentation? So you would say, now that I have pulled up your current plan and a couple of other plans in your area, let us go ahead and compare the benefits with your current plan. Now, what we're doing is I'm comparing your plan with the plan ID number, which is the Humana Choice PPO plan, right? 2643-330-000, as well as the Humana Choice HMO plan, 52323330-021, right? And depending on if you're doing 3 plans, clearly you would add the third one and say the same thing. So we're starting off with those 6 sections, okay? So I have kind of divided this here, the plan premium for your current plan, your current Humana plan, right? With the ID number, is $0. The plan premium for the Humana HMO plan with the ID number is 0, as well as the plan with Aetna, for example. The PPO C532220-000 is $0 as well, okay? Next, what we want to do is your dental benefits, okay? Make sure here that you're looking at the comprehensive care, and more important, look if there is a percentage, okay, or a dollar sign. Some plans in the comprehensive, preventative, if you just need a cleaning, x-rays, checkups, right, your annual, and then comprehensive is more so you need a tooth pulled, a crown, bridge, clean, and anything more severe, okay? So under the comprehensive, a lot of carriers actually do only have the ability that they will, just give me a second here, guys. Alrighty, I'm back. Apologize about that. So you want to make sure, because some carriers have a certain percentage under comprehensive care, which can be very, very tricky. To give you an example to better understand it here is they do offer you $2,000 in dental benefits, but you have a 50 to 70% co-insurance, okay? So what that really means, if I look at it as a member, yes, I get $2,000, but 50%. So let's say I need a crown. The crown is $1,000, and my co-insurance for crowns, sometimes they have specific categories for that. And you can always see more in the evidence of coverage or summary of benefits if it's not listed on there, right? So it says for a crown is $1,000, I have 50% co-insurance. Well, 50% of 1,000 would be $500. What that means is, even though I have $2,000 available from a dental perspective, I would have to come out of pocket $500, and then Humana, for example, would pay the other $500, right? So great, I have 2,000, but it's not 100% accessible to me when I need it. So that's oftentimes a way that you can also get members to switch to a different plan, because a lot of people on a fixed income, they do not have $500 just to spend, right? One of my members, I had her on a plan with United Healthcare. She switched to Humana. She had a co-insurance. She called me and said, can you switch me back? Ma'am, you shouldn't even switched without even talking to me. I would have told you that, right? But the point that I'm making here, guys, is a lot of times agents do not go over this information with their members. They fly over it. Oh, you get $2,000. Either they're not knowledgeable, or they don't want the member to know. And this is why I always say, always go over the summary of benefits, look over those top key areas, and make them aware. Ms. Jones, you have $2,000 in dental benefits, which is awesome, but are you aware that there is a 50 to 70% co-insurance in your dental division? Oh no, what does that mean, right? Some people can't really understand that easy. So then you put it in layman terms and break it down, just how I just gave you the example of $1,000, 50% of $1,000 is half of the amount, and then you have to come out of pocket. Another thing is, somebody is on Aetna, for instance, guys, right? Aetna is the only company, if I'm not mistaken, you have to prepay for your dental and they reimburse you. Well, a lot of people do not have $500 to come out of pocket, right? So they're never going to get the dental work done, because you require me as the company to prepay, and then you're reversing me. Okay. And there's other things, right? I could keep going on and on with different cares, and you will learn, and I will share that with you, but I want to keep going here in the script. Okay. So long story short, make sure you look over that, and then do the same thing for the primary care physician. Now, Ms. Jones, your current primary care physician, with the plan ID number, you pay $0 to see your primary. With plan number, with Humana's HMO, you would pay $0. So with this plan, and then for the specialist, you're currently paying $45. With this plan, you would pay $30, so you would save $15 each time you go. And then the last plan with Aetna here, you would pay $25. So that would actually save you another $5 from this compared, okay? So that way they can clearly see what's the difference. It's always a great thing if you want them to write down the 6 areas that you're going to go over so they can kind of make note and kind of follow along on a piece of paper what you're talking about. So when it comes time to make a decision, they can actually see, oh, this looks the best, right? And then also now, do you know what over the counter stands for? Oh, is that little where it can like get like toiletries and stuff? Yeah, some people do not know what it is. Explain. I always say it's for vitamins and toiletries. It's the easy way to explain it. And if you guys want to take a look at the booklet, we have access to most of the carriers booklets. You can always email that to the member, and you can always go into the back office on the carrier site and request it. If not, call member services with the member and request that over the counter benefits booklet. Okay. That way they can order the items. So then you compare those 3 areas. You do the same thing for eyeglasses. And then as I mentioned lastly, for the inpatient hospital stay, you look over those 3, okay? How much they have to pay. So here it's a little bit different. From day 1, you are responsible for X amount, right? From day one through X. Some plans is day 1 through 4. Some plans is day 1 through 6. Some plans is day 1 through 5. Each plan will specifically say at the bottom under that section what it is. All right. And then these are all the benefits that you kind of want to look at. Okay. In my opinion, it does get kind of lengthy. And if I'm just putting myself in the shoes of the member or the potential client, I can't remember and retain that much information. So therefore, I tried to make it a little bit sweeter and precise where I just have like a few things listed. So in this case here, I just listed those, okay? And now, as you can see, Ms. Jones, the carrier's name and plan ID number is the most benefit rich. Wouldn't you agree? If so, you want to assume the enrollment, guys. All right. And then fill out an application on Sunfire, the carrier site based on the prospect's ability to sign. Either have to get the voice signature or you can do it on Sunfire, get the e and text signature. Remember, with United Healthcare, we want to do everything on United Healthcare because United Healthcare does allow you to United Healthcare allows you to do the health risk assessment on their site only, whereas the other carriers have links for it. So it doesn't matter where you complete the application, right? And so here, once you hear the client actually give you an active, yes, I want to move forward, then we basically want to continue saying, and before we get started the enrollment, do you have any questions or anything maybe you want me to repeat one more time before we get you set up today? All right, we're going to take a long pause here and then just respond, great, we can complete your enrollment now. First, what we'll have to do is for your protection is to complete the scope of an appointment. What that means is you're giving me permission to assist you with your Medicare enrollment today, Ms. Mary. And if I send you a text message right now, would you know how to open that text message? If they say yes, you continue the scope of appointment in Sunfire. If they say no, continue to the carrier's voice signature, okay? Be sure to always record the voice signature confirmation number, okay? Keep it in your notes, and then there's also most applications, they do require you to actually put that confirmation number into the application, okay? If you're unsure about that, just take a look at the video that we recorded on the different carriers, and I will show you the breakdown of that, all right? Now, Ms. Mary, this completes the scope of appointment. Now I'm going to enter your information so that we can complete the actual application. And by the way, Ms. Mary, how long have you been living out in Georgia? Okay. While she's talking to you, you're opening basically the next step. Well, here you would basically do the next step, which is click the enroll. And then from there, you fill in the information, such as their name, address, their name spelled on their Medicare ID number, again on the second page, their Medicare ID card, the issue date, what month Part A and Part B went in effect. If you have their primary care physician's name, you want to put that on the card so that it can appear. Remember to Google the NPI numbers. So just do Dr. Mary Smith, Atlanta, Georgia, NPI number, and that will bring that up, the NPI number, because that will have to go on the card as well. And once you completed that, you would then again look at how to, we have the video of how to submit an application. And what I mean with that, if you're using The carrier website, there's a couple of videos, and then the same thing. If you're using Sunfire, I've completed a video on how to conduct an entire enrollment application, how the signature process works. And once you've completed that, you would just talk about the next step. Once the enrollment is completed, Miss Mary, this completes the application process. Here what are the next steps, right? You will receive your new member ID card within the next 2 to 4 weeks in the mail. And then also, may we contact you at a later point if we have any need, or if we need any additional information. All right, it's the best available phone number for you, 803, blah, 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 right? If you know anyone else that do needs assistance with Medicare or final expense insurance, please feel free to give them my name and number, and I would be happy to assist them. All right. And then also, just so that you are aware, my manager, Kevin Miller, will be reaching out to you in about a week. And then in a month or two down the road, the goal of his call is simply to make sure that you are comfortable. Maybe you thought of an extra question or two and just want to double check on something. Okay. He and the team are here to help. Anytime you need any immediate assistance, please call us directly at 1-800-478-7650. And don't hesitate to call me with any questions. All right. And then the only thing that you state at the end is if there's anything else I can assist you with today. All right. If yes, how can I further assist you? If no, Miss Mary, I want to thank you for speaking with me today, and thank you for choosing your senior benefit solutions today. All right. And it was a pleasure helping you. If they did make an enrollment, it was a pleasure helping you enroll into the Humana Choice PPO plan today. Remember that I'm an independent advisor, meaning I do not work for any particular insurance company. Instead, my job is to ensure that you are in best hands based on your needs. Meaning, if you ever want to make a change, please let me assist you with instead of someone else that does not truly care. All right. Have a wonderful day, and I will talk to you soon. So that kind of ends the application, guys. From that point on, you simply just want to make any last notes in the application on the member's profile on your Google Calendar. You want to add that you enrolled the member, right? You do now want to start the health risk assessment with the member if you haven't already. So you definitely want to do that. And that would then complete the application. You would move on to the next one. Right. I hope this was helpful. If you have any questions, as always, feel free to reach out to me.